Thank you to everybody that's joined us today for this session of the North Central Farm and Ranch Stress Assistance Center webinar series, brought to you by AgrAbility. My name is Paul Jones. I manage the National AgrAbility Project, and our program is responsible for bringing quarterly webinars for the North Central Farm and Ranch Stress Assistance Center. Today's session focuses on stressors and resources for farm and ranch families with disabilities. And we have two presenters. Carrie Portell is a farmer rancher from St. James, Missouri, and Dr. Robert Fetch is a staff member with Colorado AgrAbility, and I'll be sharing more about them in just a moment. For those that are not familiar with AgrAbility, we are a program sponsored by the U.S. Department of Agriculture, and we focus on accommodating disability issues for people involved in agriculture. Every one of the AgrAbility projects around the country is a partnership between a land-grant university and at least one nonprofit disability services organization. There are currently 20 state AgrAbility projects, and there's also one national AgrAbility project that is led by Purdue University's Breaking New Ground Resource Center. Our partners on that national grant include Goodwill of the Finger Lakes, the Osteoarthritis Action Alliance, Colorado State University, and Washington State University. You can find out more about AgrAbility at agrability.org, including we have about 100 archived webinars that you can check out at your leisure. A little bit about the Farm and Ranch Stress Assistance Network, known as FRSAN. It was first authorized in the 2008 Farm Bill, and its purpose is to provide stress assistance programs to individuals who are engaged in farming, ranching, or other agriculture-related occupations. And there are 4 regional FRSAN centers around the country, covering every state and all the U.S. territories. If you're interested in getting some basic information about FRSAN, you can go to agrability.org/resources/FRSAN, and you can find contact information for all 4 of those regions. We'll continue to add information to that page as we get it from each region. At this point, I'm going to introduce our 2 presenters. Carrie Portell, again, is a farmer rancher, and she's from St. James, Missouri. Just before Christmas, or excuse me, just after Christmas 2010, she and 2 of her daughters were driving and were struck by a drunk driver. She sustained severe injuries that required multiple surgeries and extensive rehabilitation. It took about 4 years for her to be able to walk again without support, and she still has some issues in regard to mobility. She has had assistance from Missouri AgrAbility and has been able to continue in agriculture. And she's also a national speaker and most recently an author. You can find out more about her at her website, carrieportell.com, if you'd like to find out more about Carrie. I'll go ahead and introduce Dr. Fetch. While we're doing that right now, Bob Fetch has been a longtime AgrAbility staff member. He's worked in a university extension for about 32 years, first at the University of Kentucky and then at Colorado State. It's been over 41 years when he's been working in terms of family life issues, especially related to resilience and stress. He's officially retired, as I understand it, in 2011, though you couldn't tell that by his level of activity. He still works with farm and ranch families, dealing with things like stress, anger, depression, suicidal thinking, and he writes a number of publications in regard to quality of life and all those issues. So at this point, I'm going to turn things over to Carrie. I'm going to transfer the presentation mode to her, and I'm going to remove my presentation. So Carrie, please go ahead and feel free to share.
Great. Thank you so much, Paul. Hi, everybody. Like you said, my name is Carrie Portell. I live in the central United States in Missouri, more like East Central part. For the first time ever, I get to talk to you specifically about the mental health and stressors of farming with disabilities, and that farmer is actually myself. I am the one who has the disabilities. I say that I'm partially disabled because I can still do things like a normal person, like I used to. Technically, I guess I am disabled. So, short version of how I received my disabilities was 10 years ago, this past December. I had my two middle children with me, and we were going to a neighboring town at about 6:20 in the evening when a drunk driver hit us head on. There was actually 4 vehicles involved in that crash. We were the second one in line, and I think that kind of helped us with our injuries, even though we were the ones who had the most impact with that impaired driver. Now, I had sustained multiple injuries, but the disabling ones were from my waist down. We'd actually had 2 points of impact. The first one was head on my side, the driver's side, and then it flipped him around to have a second impact into my door. So then I had injuries a lot to the left side of my body. Now, those injuries were mostly to my lower legs and ankles, and that truly is what disables me today. They were shattered, dislocated. I have huge fractures in my pelvis area. So those 3 things combined make it very difficult for me to walk. All 3 of those joints are now fused, which means they don't move anymore. And to date, I have had 13 surgeries total. I have had 5 on each ankle and 3 on my pelvis to get me to the point that I am at today, where I can still walk part-time. So I am a part-time wheelchair user. I can take around 1,700 steps a day if I spread them out and use them wisely. The rest of the time, I do use a wheelchair and a mobility scooter. Now, being able to farm with those kind of injuries doesn't really make a lot of sense to people, but when I explain how I use farming and what it has done for me, many people then who are in our industry really understand. And I've been asked, how did your family deal with all these injuries that you had, and what kind of stresses did it put on them? And when something of this magnitude happens to you, it affects your entire family. It definitely does not stay with just yourself. And I was at a point where I was in a wheelchair for full time for 18 months. It did take me around 4 years to recover to where my surgeon said, okay, Carrie, this is about all we can do for you at this point. But for 5 full months, I basically could do nothing except allow my bones to heal. I just, needed my body to heal from that trauma, because if I didn't have my legs elevated, they hurt even worse. So my family had to do everything. I mean, they cooked, they cleaned, they did the laundry, they fed me, all that kind of stuff. So the stresses on your family are very, very real, and they can be very severe. Now, I was also asked to talk a little bit about how it was navigating the social services system, because we realized pretty quickly I was not going to be going back to work right away. Like, this was going to be a very long, strenuous recovery for myself. And I don't know if it's like this in every state, but in Missouri, I believe you have to be considered disabled for at least 6 months. Our car crash happened on December 29th, and it was sometime in October before I actually was considered disabled so that I could collect my Social Security disability. And at that point, it was a godsend, but it is so much paperwork and so many things that you have to do to justify that you need that Social Security disability. So it was definitely a real chore. I'm pretty fortunate that I had a representative that was patient and for me to understand, one, I had the stress of physically healing going on, but I also had this mental and emotional stress that was every bit as overwhelming as that physical stress, and trying to comprehend a lot of what was going on with that social services criteria was hard for me to understand, because I was also having so many surgeries that I was constantly under anesthesia and pain medicine. So luckily I had a representative who was very patient with me. And then, some days I would just say, you're going to have to call my husband because I'm not grasping what's going on here. Now, a lot of people have asked me, Carrie, how do you farm with your current physical situation? And for me, even before I got out of that wheelchair, during those first 18 months, I realized I am a person that I cannot just sit back and let life pass me by. I can't allow people to wait on me hand and foot. It does not go well with my personality. I am a very independent person. And at the time of our car crash, we had 4 children that were the ages 8 to 13. So they were very close in age. And boy, did they keep me busy. And basically going a mile a minute to coming to a complete halt was a huge impact on all of us. And that does stuff to you mentally. Like, you don't know what to do with yourself. Your surgeon says you have to sit here and heal. You've got to let this part, catch up. And it's so hard because your mind still works correctly. It still says you can do all of these things, but your body just won't cooperate. So that was a whole other challenge that I had to go through. And I feel like I completely understand what it's like with that struggle that the older generation goes with, because their mind still says, hey, I should be able to do all these things, but their body won't cooperate. And that's exactly the point that I was during my recovery. Now, I would get in my wheelchair, I would wheel myself out to the truck and be able to pull myself in the truck. And I would go around and drive to the farms. And, luckily I was able to take a kid or two with me, and they would open the gates and just go check cows during calving season. And for me, it was such a huge accomplishment, something so trivial to everyone else. But for me, I needed a purpose. And I did not realize how much I needed to feel accomplishment. And that was a huge hit. Like, I didn't realize how much I needed to be able to contribute to my family, or just have something of my own that I was able to do. So the kids and I would go check cows, and, I'd report back to my husband and say, okay, cow 45 is probably going to calve in the next 3 days. We need to watch out for her. And it was something so small for me to be able to do, but at that point in life, it was something that felt so huge. And my husband truly appreciated it, because then he would not be worrying all day at work saying, okay, which cow is going to calve today? And he then had to change his worry to, what kind of situation did Carrie get herself in today, which is a running joke. But I soon realized that going back to farming in the simplest way was a healing for me. It was a mental and emotional healing, because it gave me something that I was missing during all of those months where the only thing I could do was sit and heal. And I needed it desperately. It was something that was able to get me out of the house. I could contribute to my family, because I was feeling very vulnerable at that point. I was feeling pretty helpless and really useless at a lot of points, because moms do everything. The kids come to mom for everything. And at that point in my life, I couldn't do what I used to on any sort of level. So for me, ag definitely became a mental and emotional healing in the first stage. And then as I was able to progress a little bit, I had physical therapy 2 to 3 times a week for years. And my physical therapist and I became very good friends. And after a while, he said, Carrie, you have a farm. He's like, you don't need to come in here 2 and 3 times a week to get physical therapy. I can tell you what to do on your farm and you can do it yourself. And then it was basically a 2-for-1. So I was able to give myself physical therapy, but also complete small chores on our farm as well. And I took him up on that and just trying to figure out how to do certain chores on the farm again in a manner that my body could handle proved to be pretty difficult because my mind was still wanting to work with a body that was pre-crash, pre-injury. And I had trouble getting it to switch to a body that wouldn't work correctly anymore like it used to. And I felt like I was being pretty creative in how to do many of those chores, but at one point I got stuck and I was starting to get very, very frustrated with my inability to think outside the box. And really it came down to I did not have the knowledge or the skills to work with a body that I now had. And by chance, I sat beside an AgrAbility rep at the Pearls of Production Women's Conference in Columbia, Missouri. And I believe that was around 4 years, that fourth year mark after my surgery. And she said, Carrie, you have got to get a hold of AgrAbility. They will help you. And boy, did they. Now, I got to tell you that I am a huge advocate of AgrAbility. I will promote them at any possible turn that I possibly can in my life because they have helped me get my life back. I am unable to work a normal job. I have tried and failed 3 times, but being able to farm on my own property, they have given me that skill and that knowledge that they have, that they use every single day and taught it to me. And I could not be at the level that I'm at without them. Now they come out and do a wonderful assessment on you, and they're not just my representatives. They have all become my friends. And if there's any way that that we can get the word out there to everyone, because it's almost kind of hidden. I had never heard of AgrAbility prior to this. And now I'm thinking, how did I not have this in my life? And I need everybody else to understand that there is help out there. And I know if any of you are AgrAbility reps on here, I want to thank you from the bottom of my heart for doing the job that you love, because it's a very hard job. And you have to be on call all the time for people like me who need that guidance, who need that constant motivation of, Carrie, don't get so down on yourself. We can help you. We can do this. And they have given me many tools and equipment suggestions to get me farming to the level that I'm at today. And I will forever, ever be grateful for the opportunity to be an advocate for them. So that is all I have for you today. I know we have questions after our presentation here, so I will definitely be staying on for any kind of specific questions that you have for me. So thank you, Paul.
Thanks so much, Carrie. Certainly appreciate your testimony there, and also just your example to many of us in AgrAbility, and we definitely appreciate you. I'm going to turn things over to Dr. Fetch now. I'll make him the presenter. And we'll open his presentation.
Hello, everyone. Thank you for joining us today. Carrie and I really appreciate having so many of you with us today. I want to start with what Carrie said, is how her accident, whom all did it affect? And she said it affected everyone in her family. And a family is like a mobile. A mobile, you might see these chairs on this mobile. If one person like Carrie, well, first of all, most families strive for what's called homeostasis, or balance. They strive for equanimity and for harmony in their families. And as you can see, the mobile is balanced. But when Carrie got her accident, boing, that affected all of the other family members. And it doesn't matter which person it is in the family. It might be a child that's identified as cancer, or it might be a spouse, or it might be the primary caregiver. Whoever is affected, it affects all the other family members, just as this mobile did and just as she said. Well, pain is not always obvious. I remember a physician telling me one time, every time I deal with a farmer or rancher, I've got to remember, when I use that 0 to 10 scale to say, how high is your pain? And they say, oh, it's a 4 or a 5. I've got to translate that, because farmers and ranchers are so tough, so strong, so resilient, that what that really means is it's an 8 to a 10 on a 0 to 10 scale. So pain is not always obvious. I want to dedicate this presentation today to two of my best teachers in my life. My dad, Paul J. Fetch, and my mom, Marcella Fetch. Thanks to my parents, whose hard work with their dairy farm taught me how to work hard and be successful. Well, our agenda today, Paul asked me to cover 5 things: psychological impacts, stresses of acquiring a disability, and Carrie already covered a number of those. And then also she covered added stressors of trying to continue farming and ranching with a disability, and increased family stresses associated with a disability. Then the whole stresses of having to navigate the social service systems, and finally resources. Well, first of all, psychological impact stresses. These vary. If somebody in your family has an illness or condition like cancer or an accident or MS, your family may be one of those that doesn't miss a step. And my family might be one that's just devastated and overwhelmed with it. There are a lot of different reactions. Those families that are high resilience figure out workarounds. It's not severity of limitations, it's supports they use that make a difference. This is from my colleague and friend Candy Leathers, who works on our Colorado AgrAbility project. In one of the studies that I like to cite, it asked what were the top stressors for farmers. And in a sample of 1,300 Iowa farm residents, number 1 was death of a spouse, and that's highly understandable. Death of a child is right under that, and look what's next after that. Disabling injury to oneself and foreclosure on a mortgage. Disabling injury of a family member or disabling injury to oneself. That's very high on the list of farmers and ranchers' top stressors. One of the things we did in the mid-'80s, back during that bad agricultural crisis, was we did a study with 300 randomly selected farmers and ranchers in Colorado and 300 randomly selected farmers and ranchers in Wyoming. I was working with ag economists at the time. We were interested in stress levels and depression levels and how that was related to the whole thing about last year's income, last year's debts, overall income, and overall liabilities. And then the 5th question was one I wrote, which was, as I think about my overall situation, how does it look from me from 1 equals dismal to 7 equals excellent? And what we found was there were low correlations between the amount of income they had last year, the amount of debts, or overall economic value. It was the perception, the meaning that made the most difference. That was highly related to the stress levels and to the depression levels of what farmers and ranchers experienced, more so than just how much money they make. We had people that made $30,000 last year who felt like they were at about a 6 or a 7, doing okay financially. And we had people who had $1 million last year and they thought they were just so-so. Well, how do you know when your partner or best friend is stressed? Paul sent out to you a copy of our checklist and guide for making referrals, and so I refer you to it. It's got a lot of signs of stress that you may want to pay attention to and be sure that you know about, so you can interact well with someone who in your family or neighbor or friend that might be stressed out. Well, we know that Elizabeth Kubler-Ross, the Swiss psychiatrist, was the one who first introduced the DABDA model: denial, anger, blame, depression, and acceptance. In my work with farmers and ranchers, I've worked, especially those with disabilities, I've found that there are more steps than what she had, that people go through, people like Carrie who go through their situation. There's denial and shock, mourning, withdrawal, anger and blame, bargaining, depression, reassessment and reaffirmation of who I am, coping and how do you move around, like she talked about, from walking to being fully in a wheelchair to then partially in a wheelchair with 1,700 steps a day. The dialogue with a therapist or with a trusted family member or friend, self-acceptance and self-esteem and joy of life. Now keep in mind that this is not a static thing. Some people go through none of these stages, some people go through 2 or 3, and some go through all of them. But it's a very dynamic thing. You might be at anger and blame, then coping and mobilization, then depression, then mourning and withdrawal, then coping and mobilization, then reassessment. It's very dynamic. And each person, the person with the disability and the rest of the family members, go through these different stages at different times. What are the added stressors of trying to continue farming and ranching with a disability? Most significant, according to Candy, my colleague, is financial, especially when you need major assistive devices like a flatbed truck with a lift on it. Those can cost $30,000, $40,000, $50,000. Other things are quite more affordable. As you might have seen on the National AgrAbility Project Toolbox, there's over 600 or 700 different ideas of adaptations, many invented by farmers who are basically engineers in my mind without the degree. So some modifications are not so expensive. Another question families face is, how do we address the lost production and income? Who picks up the slack? The spouse, the partner, children, banker, a neighbor, a friend, a cousin? My family has faced a situation here in the last 3 weeks, and the whole problem is who's going to chop the ice for the cattle? Who's going to feed the cattle? And when we get to it, who's going to harvest the crop? Well, farming and ranching is a vocation, a calling. It is not a Monday through Friday 8 to 5 job. So there are a lot of increased family stresses associated with a disability, like what if she or he gets a secondary injury? What if she or he can no longer function as primary breadwinner? Who will do what? Who's going to take over our operation? How do we handle the financial losses? And what do we do if we have no one to take over? Most farm families are multi-generational. According to USDA.gov, nearly 98% of U.S. farms were family farms in 2019, owned by the operator, by a farm operator, family farm operator, and related individuals. So what appears to differentiate those farm families with a disability who will be better off in the next 3 to 5 years, who will be about the same in the next 3 to 5 years, who will be worse off? Well, there are 3 things that will make the difference, and you can figure out which group you're going to be in if you have a disability, an illness, or a condition. First of all is pileup, and that has to do with what else happens. Who else gets cancer? Does grandpa or grandma get Alzheimer's? Does someone contract MS? Is there another accident? Does the herd get a disease? Do we need to have elective surgery? It's a good thing sometimes to postpone elective surgeries and other things that you can wait with. The second is resources used. As Candace Leathers said, it's the resources they use that makes the difference about how resilient they are here in Colorado. It be internal strengths like individual family members have, or outside strengths like Division of Vocational Rehabilitation. Carrie mentioned Social Security as an outside resource, and the Missouri AgrAbility Project. And then finally, there's meaning or perception. She talked about that too when she talked about I had to find out a new way of meaning for myself about how I can contribute to my family. One farmer told me, the day I had my accident was the best day of my life. And I asked, why is that? He said, because it woke me up to what's really important, my spouse, my parents, my kids. I encourage you to practice reframing your negative perceptions to positive ones. Well, how do you know when a partner or best friend is depressed? You can go to that checklist that Paul sent out to you, and you can find a number of symptoms there to watch for. The common cold of modern psychology is depression. And what is the best, most effective cure for depression? Primarily, it's counseling and antidepressant medication. Also, taking good care of oneself and exercise. Most people with clinical depression, if they will do these four things, they will come out of that depression before too long. Well, one of the things that farmers and ranchers sometimes think is if I'm not able to operate like I was when I was a young man or a young woman, and I was strong and able to do most anything, now that I'm in a wheelchair, or now that I've got this disability, etc., you might as well take me out and shoot me. No, I disagree with that. As an AgrAbility co-project director here in Colorado, we give hope, and we try to provide ways that people can redefine what their situation is. We try to prevent depression, reduce depression, and prevent suicide. In this study by Peterson, Sussel, and others, 2020, they looked at suicide rates for males working in major industry and occupational groups per 100,000. And overall, with all industries or occupations, right here they found that the average was 27.4 per 100,000 suicides. But for farming, fishing, and forestry, it was 15% higher. It was 31.4 per 100,000. And for agriculture, forestry, fishing, and hunting, it was 32% higher than the average. So we've got a dangerous occupation that can lead to suicide. We've seen progress in reduced numbers of physical fatalities and injuries in agriculture thanks to efforts of OSHA and Extension farm safety programs, but we've not seen enough progress, in my mind, in reducing behavioral health issues like suicide, especially among older white men. So who is most at risk of suicide? If you look at this slide, it tells us very clearly who is most at risk. If you look at the bottom here, you see Black females peak at suicide rates at about 5 per 100,000 at age 25. White females peak at about 12 per 100,000 at age 50. Black males peak at about 22 per 100,000 at about 20. But now look at white males. They're at 30 per 100,000 at age 20. They go up to about 38 per 100,000 age 55. And then look, boom, here at the time when they get to be in their 50s, 60s, 70s, 80s. These are the people that are really at risk. They get up to 2.7 times higher than the national average here at 38 right here. And when they get up to 85, they are 3.6 times as high as the national average. So if you know of a farmer or rancher who loses their spouse and their meaning, their purpose in life, watch out. Watch out. Be sure and watch for signs of depression. Factors that may contribute to this risk of suicide for farmers and ranchers include depression due to chronic pesticide exposure, increased access to lethal means. Firearms and hanging are the two leading methods of suicide for farmers, and sometimes it's hard to find good mental health counseling or time to go to it. It's not increased levels of mental health issues. It may have to do with the demands they face or the culture we face. We think that it has to do a lot with how we script our little boys as different from how we script our little girls. The messages that we give our little boys is often no sissy stuff. Men are expected to distance themselves from anything feminine. Be a big wheel. Men should be occupationally or financially successful. Be a sturdy oak. Men should be confident and self-reliant. Give them hell. Men should do what is necessary to make it. And I think there's a sixth one. When you're hurting, be a man. Keep it inside. These are all dangerous because they can lead to higher incidence of stress and depression and suicide. 3 out of 4 suicides across the country are committed by men. If you look at this slide, you can see where the dark red areas, the mountain states out here, have the highest suicide rates, and they have had over the past 35 years. And then you can see on down to other states that have lower depression, suicide levels. So what can you do? Watch for subtle signs that something is not right. Don't wait for the right time. If you think you suspect something, listen well. Hear the sounds of depression and suicidal thinking. Don't just say, "How are you?" but say, "How are you doing, George? You must be going through hell. Tell me about it. I'd like to hear." Reach out. Connect well. Connect them with local professional behavioral health therapists. Connect them with a family member. Connect them with a family physician, a minister, a veterinarian, priest, a milk feed hauler, AgrAbility team members, extension people, FRSAN people. Stresses from having to navigate the social service system can be confusing, unfamiliar, or scary. People don't know where to go or what to do. How do I find a doctor I can trust? My wife's son and daughter-in-law usually takes care of that. Why do I have to give you all that personal information? And then we like to deny it. Surely tomorrow is going to be better. So who are some resources? Well, first of all, is the National AgrAbility Project. They have lots of resources at their website and good people who really care. Our Colorado AgrAbility Project works closely with Division of Vocational Rehabilitation with farmers and ranchers with disabilities. We provide coaching, encouragement to deal with trust issues, frustration, impatience, complexities. And sometimes it takes a long time to get things worked out. There's also FRSAN and Western Regional Assistance Stress Assistance Program. Colorado AgrAbility Project is addressing 3 roadblocks. There's the stigma around men recognizing signs of high stress, anger, depression, and suicidal thinking and seeking counseling. There's the reluctance of many men to follow through with counseling, and the lack of agricultural competencies among some mental behavioral health providers who don't realize that farming and ranch is not a 9-to-5 Monday through Friday job. It's a day in, day out, from sunup to sundown. One of the things we're doing here with the Colorado AgrAbility Project is we're working with FRSAN. We have a job opening right now for a behavioral health specialist with a master's degree in behavioral health, preferably in marriage and family therapy. Here's the link if you know of someone who might be interested in applying for this job. I'll show this again a little later. So how do we know AgrAbility works? In one of our studies with 14 states, we had 2 groups. We had the group of AgrAbility participants and the group, a group that of farmers and ranchers with disabilities who were not in AgrAbility. The psychological well-being of AgrAbility participants increased 28%, while the non-AgrAbility group's psychological well-being fell 4%. Similar thing happened with support levels. In 14 states, the group AgrAbility participants' support levels improved 20%, while the non-AgrAbility group's support levels fell 5%. So in those states that have participated in a quality of life study, we know that we reach out. Like Carrie said, the Missouri AgrAbility team has become their friends. I think that's a big part of why the support levels are improving so much among our participants. Where can we find resources for dealing with disability? Well, one thing I'd suggest is our own fact sheets here at Colorado State, 10 tips for successful family meetings. This is a good thing many of you might want to take a look at and start having family meetings to deal with the stresses and strains when you have a disability. So when you notice a problem, where do you go for help? I like these 4 websites to be able to find trusted, licensed, skilled mental health and marriage and family therapists. If you're unsure, refer, and you can find the steps how to do that in the handout that Paul sent you. Be careful out there. Take good care of yourselves. And so now, Carrie and I will open everything up to questions.
Thanks so much, Bob. Lots of good information there. And we will be planning to post slides on our website archive when that's available. So you can take a closer look at some of these.
No, it doesn't. It was good. Well, we'll start backwards. Question came in, and we've got a few that are specifically to Carrie or to Bob, and a couple that we'll throw out, and whoever wants to take a shot at it. Are there any questions or any concerns about the aftermath of COVID and its possible impacts on ag producers, long-term health concerns, etc.? Is anybody looking at that, researching that yet?
Yes, I've heard of several people who are looking at what's called long haulers effect. Those people that are having pulmonary or neurological impacts from COVID long range are being studied now. Yes. Carrie, did you want to add to it?
No, I have not been involved in any kind of research. I'm pretty much on the other side, just waiting to hear.
Okay. I think this probably was directed to Bob, but I think both of you can have an input. Any thoughts on how to approach farmers who have very negative perspectives on the value of mental health services due to generational bias or influenced by institutionalization?
Let me give it a whirl and see if it'll go. I've certainly had some of these discussions, and I don't always succeed, but here's my best spiel. Okay, so you're not so sure about mental health services. Yeah, a lot of people feel that, but let me ask you this. With one of your cows, if one of your cows is having trouble calving, and it turns out she's been at it for 24 hours, and you realize, oh, the calf is dead. So now what are you going to do? You're probably going to call your veterinarian, and you're going to pay several $100s to have him or her remove that calf and save your cow, aren't you? Now, let's say your John Deere tractor fails, and the computer in it fails, and you don't know how to figure all that out. So what are you going to do? You're going to let it sit in the field and just let it die? Probably not. You're probably going to pay hundreds of dollars to have a specialist come out and fix it, right? Aren't you worth more than a cow? Aren't you worth more than a tractor? Then how about investing a little bit of money into taking care of your well-being, your mental and your physical health? Because if you don't take care of yourself, nobody will, and your family will really suffer. You're worth it. Okay, Carrie, how would you try it?
I was actually going to give a few experiences that I have had, and it mostly comes to me when someone has either accepted the situation that they're in or were forced into a situation that they never thought that they would be a part of. So every so often I will get a call either from a farmer, themselves, or most of the time it's a family member, and they come to me just because I've been open with the struggles that my family and I have had. And I think they come to me more so because they know that I will understand what they are talking about, what they are experiencing. And they, one, need the camaraderie of, unfortunately, being in a group that they never wanted to be in. But the second is they want the knowledge that I have learned the past 10 years on how to deal with it, almost sometimes giving them permission to seek out help. Because if I say, yes, I sought out help at a certain time in my life, it gives them the feeling that, hey, I'm not the only one. So my circumstances are, if I can get to that person while they're in that situation where they are vulnerable and are more open to help because they feel desperate, that's where I have made my approach to, kind of guide them on to someone who is more educated than I am in that specific either mental health services or the AgrAbility part of it.
Okay. Thank you both for those thoughts. Bob, this was directed to you specifically. What additional stress intervention training would you recommend for professionals?
That's an excellent question, particularly for rural behavioral health and behavioral and mental health people. I strongly recommend several things. One is to contact Mike Roseman in Harlan, Iowa for his program, his workshops, his series on agri-cultural competencies. His program will be, we're going to be using it here in eastern Colorado pretty soon. And so some of my colleagues there will be providing training for behavioral health people. I think that one is an excellent one. We will also have Dr. Lisa Tupa, speak on suicide prevention in November here in our next webinar here at the Colorado AgrAbility Project. And she is excellent with regard to suicide prevention. So those two things would be trainings that I would suggest that mental and behavioral health professionals take advantage of.
Carrie, would you have any input from your experiences to add?
I had several places kind of reach out to me and ask me if I would, need some kind of help. I had, since mine was a car crash, I had the Highway Patrol reach out to me and offer services that way. Immediately, whenever I got with AgrAbility, they suggested, hey, if you need some mental help, just accepting your situation, they were able to guide me to someone. If you don't have access, I guess, or don't know where to go in your area, your extension rep is a phenomenal resource to get you help. And most of the time, if you're in a rural area like I am, your extension rep. So you can go to them, be confidential and say, hey, what kind of help can you get me specific to my problem?
Great. Okay, here's a interesting one, is financial help to pay for farmers and ranchers, or to help farmers and ranchers pay for counseling.
Depends on where you are.
That is an impediment.
Yes. I've just learned last week that some of my colleagues working with the FRSAN Western Region group here are about to roll out a system whereby Farm Bureau is working with a number of other groups to pay for, I think it's up to 6 sessions for Colorado farmers and ranchers. Sorry about you, the rest of you in the other 49 states. Apparently there's going to be a limitation here. But at least in our state, yes, we've got people working on that very thing to provide financial help for up to, I think, 6 sessions for farmers and ranchers. Some other states have also started to do this. So you might ask your FRSAN team whether anyone in your state or your region is doing this. FRSAN would be a good group to approach on this, because they know about this issue.
Okay. We actually just had a comment come in that FRSAN in the North Central region is also doing something similar to help pay for counseling. Missouri has one program and Wisconsin has another. So I would assume there's probably some others out there. So, okay. Carrie, question for you. Did you have to deal with stress and anger issues related to the person that hit you in your accident?
Yeah, that's probably a number one question that I get. I don't know why I was not angry at him. I think on one level, I was in so much pain, like it was all consuming, that in the beginning, the only thing I could strive to do was just exist from day to day. I mean, and it was a constant battle from hour to hour. I did have stress and anger with the physical abilities that were stolen from me. So I was very independent. I basically had no limitations. So whatever I wanted to do physically, I was able to do. I was a very active person. So the stress of not being able to just get up and get my own glass out of the cupboard became, I mean, just of the trivial task became very frustrating to me. And I was more frustrated with what I couldn't do than this actually happening. And I think part of that is I accepted that there was no way I had any control over this happening. It was happening even whether I wanted it to or not. Somebody made that choice for me and, you know, kind of stuck me with the consequences. I think another thing is this gentleman lost his life whenever he hit me, and he passed away on impact. I feel like he paid the ultimate price for his choice that night, and he was not here for me to take out my frustration on. And when I looked at my family, I had to remember that this was not their fault. They did not do this to me. So even though I was frustrated with what was going on, I had to make a conscious choice not to take it out on them. So it was more of an acceptance thing. Now, I would say it would be harder than because he was a local gentleman, if I had to go into town and see him every day while I was wheeling myself, you know, around the grocery store or something, that might bring up a different feeling. That might be harder for me to handle. But I forgave him pretty early on, but even though I forgave him, it did not stop the frustration with what I couldn't do, and that my journey was taking such a long time. You know, I just wanted to walk. Well, it took me 4 years to be able to walk. So that's, I mean, wasn't a short amount of space. So really nothing towards him, but more towards just my situation, my physical situation.
Thanks for sharing that. That's one piece of advice you would provide to another who's just acquired a disability.
The one piece of advice that no farmer wants to do, and that is accept help, accept that guidance. I think we're all out there trying to change the stigma of farmers being, you know, so prideful that they won't accept someone else saying, hey, I got a suggestion for you, or hey, I've got this program, you know, like AgrAbility, and it's hard for them to reach out. So there have been a few instances where I have asked my AgrAbility rep to reach out to someone that I know, because I knew that that was the only way that that farmer was going to accept that help, is if they contacted the farmer specifically. So, you know, just, it doesn't have anything to do with your pride. It's working better, it's working smarter, instead of just making things so hard on a day-to-day basis. AgrAbility and other programs like that can help you.
Excellent. Let's see. This is a comment, Carrie, that you've posted that I imagine everybody saw, but I think it's worth restating about the impact of the financial stress. And thanks for sharing that.
Yeah.
We did have a couple other questions came in that I don't have on slides. Let me look on the other screen here. Let's see. Do you find that the age in which a disability is acquired increases the stress and effects on the disability for the individual? For example, living with no disability for 50 years, then suddenly being unable to complete farm tasks. Either one of you?
Yeah, I would say we would both agree on that.
Oh yeah, a big part of it, no matter what the age is, because like I said, farming is a vocation. It's not an 8 to 5 Monday through Friday job. Farming is who I am. I'm a farmer, and so when I can't do that anymore, who am I? Am I no longer a farmer? Am I anybody? Am I nobody? Am I worth anything? Those existential questions that many farmers and ranchers face, whether they're 20, whether they're 30, 40, 50, 60, or 70 when they get a disability. It's a huge existential question because farming is such an identity thing for farmers and ranchers. So yes, it is huge, and that's why there's so many stages, I think, that many people go through, like I showed you there. Carrie, how would you go with that?
Yeah, I mean, talking from experience, I had just turned 35 whenever our car crash happened. And, I didn't think at all about not being able to do the task that I had done the day before. So for me, like I said, I was going so fast in my life. And then I literally hit, like a brick wall where everything stopped. And it was a huge adjustment, on every aspect. And like I say, the physical and emotional was every bit as overwhelming as that physical part.
Okay, let's see. Here's what kind of stress or mental health resources do you wish existed to help farmers with disabilities? What's your wish list? What do we need to have?
Well, prior to me knowing about AgrAbility and those type of programs, that was my wish, and I didn't know it was out there. It just doesn't get shared in our area enough. So my wish basically came true. There are organizations out there, if you know what and who to look for, that can help you.
Okay.
Yes, my wish list would be that mental behavioral health professionals, my wish would be that we could set up here at Colorado State in our marriage and family therapy program an extra specialty of training young professionals how to connect well and deal well with farmers and ranchers with emotional and behavioral health issues. And then they would partner, be co-therapy. A male and a female would go to the farm site and work with them around their kitchen table with all the major stakeholders, and work with them not 55 minutes in their office in mental health, but on the farm, on the ranch, for maybe 3, 4, 5, 8 hours, maybe 2 days,
sure,
once every month or once every 2 months. That clearly would be an innovative way of approaching behavioral health and mental health behavioral issues. But that kind of thing would build on the good thing of what works with AgrAbility as to how those teams establish such good support for people. So thanks for asking for my dream. I'm happy to talk about
it. Throw it out there. Yes. I'm gonna stop sharing my screen. I think I have a question that came in directly to my line that I can't see until I do so. So.
Anyway, the question is whether the slides would be available. We are planning to put those up on the website. I did not see any other ones really, unless it went directly to you.
I think it went directly to me, if I can find it here. Okay, here it is. Are there any resources targeting alcoholism and substance abuse among farmers and ranchers in rural areas, or in rural areas?
I can answer that on, there's an organization called AgriSafe, and they're founded by nurses who specifically target alcohol and substance abuse.
Yeah, that's great to talk about, because in my experience here in Colorado and Wyoming, and the drug of choice usually is alcohol. First of all, it's a legal drug, and many of us enjoy it, and some of us enjoy it a little too much. And so many mental health, behavioral health places have an alcoholism therapist in their office that you can go to too. But AgrAsafe, like you're talking about, Carrie, is another good one.
Okay.
I think that's all the questions I see at this point. So thank
I
you
just want
both.
to say thank you again to Carrie and Bob for an excellent set of presentations today. We, again, just value your participation and support of AgrAbility. We appreciate everybody's attendance and also for sticking around for a few extra minutes here. Again, we'll get this recording put up as soon as we can. And if you registered for this particular session, you will definitely be on the list to receive information about future sessions. So with that, I will bid you all a good day and say thank you very much for attending.